So we are live on YouTube, we are live on Facebook, and we're just checking if we are live on LinkedIn as well. Yeah, we're live on both YouTube channels, live on LinkedIn. Okay, good. So let's just get started. Thank you, everyone. Good evening, and thank you for joining today. Thank you for making your own health a priority, because it is the festive season, but it's also the right time to think about your own health. Today we are doing a discussion on breast cancer in young women, and we strongly believe that the message really is that act now, save lives, because breast cancer is treatable. Let me quickly introduce our panelists as well. But before that, just a reminder that Patients Engage is an online platform which seeks to inform, engage, empower patients of chronic conditions and their family caregivers. And we strongly believe that lived experiences of patients and their families matter, as well as the more informed patients are, they will be better prepared to participate in decision making and make the right choices as well. Quick guidance to the attendees on all the platforms. The information here is not to replace a medical consultation, so please do consult your doctor for specific medical issues. This session is being recorded and will be put up on YouTube as well. And if you're logged into Zoom, you can please post your questions in the Q&A box. If you are on any other platform and you want to send in your questions anonymously, you can always join us on the Zoom platform. The webinar ID is 875-7071-5453 or 22441 passcode. And if you are on any of the live channels, you can post the comments, questions on the live feed. We have people who are picking those questions up and making sure that we'll address them. And you can always follow us on all our social media channels. For those of you who are cancer survivors or caregivers, we do have a Facebook group called Cancer Power Circle. So you can join it to meet other cancer survivors and family members, as well as join in the discussions and in the meetups. So getting to the panelists, we are very privileged to have with us Dr. Rohini Patil, who is a breast cancer survivor and an OBGYN. She operates out of Nagpur, and she's very, very passionate about a few topics. She's a trained lymphedema therapist, and she's also passionate about body image and self-esteem of breast cancer survivors, and therefore she runs this Knitted Knockers initiative. We also have with us Dr. Poonam Patil, who's a medical oncologist at Manipal Hospital in Bangalore. And she has more than 20 years experience, very active in research, and very passionate about breast cancer and women's health. We have with us Dr. Sajjan Purohit, who's Director Medical Oncology and Center Head of Max BLK Delhi. He's been very, all along with, for a long time with the Rajiv Gandhi Cancer Institute as well. And he's also very active and, active even in terms of social media and trying to get people more and more aware about breast cancer. Dr. Anita has also joined us. Dr. Anita Ramesh is a medical oncologist at Apollo Hospital in Chennai, active in clinical trials and research on breast and cervical cancer. We also have with us Seema Ahuja, who is a global head and SVP of communications and corporate brand at Biocon Group and Biocon Biologics, who are our sponsors for the event. And she has, she's a multifaceted woman leader with over 30 years of experience and very well awarded and recognized in her field. The moderators for today's session are Urvi Sabnis, who is a breast cancer survivor, and those of you who are aware of Patients Engage and Cancer Power Circle, she's very actively involved with us. And I'm Aparna Mittal. I'm the founder of Patients Engage. So let me first request Ms. Seema Ahuja to say a few words and kick off the session.
Thank you, Aparna. Very good evening to our esteemed panelists and all the viewers who've joined us today for this public awareness webinar organized by Biocon Biologics in collaboration with Patients Engage Forum. Act Now, Save Lives was conceived with the view to provide a platform to young women and men to engage with experts and learn about the importance of regular screening to cut down the risk of breast cancer and how early detection can stop progression. And overall, early treatment can lead to much better patient outcomes. Breast cancer today is the most prevalent cancer in the world, and we are noticing a sharp increase in the incidence in young women under 40 years, especially in urban cities. Our doctors today will talk about the reasons behind the rise in this prevalence, the risk factors that Indian women, especially young women, should be aware of, and what they must do to reduce the risk. Biocon Biologics is a fully integrated global biosimilars company, which has succeeded in taking 5 molecules from lab to market in many world markets, including US, Europe, and Japan. At Biocon Biologics, we are driven by our mission to transform patient lives by expanding affordable access to high-quality biosimilars. We have a strong pipeline as well as in-market products for cancer, autoimmune conditions, and diabetes. We are leveraging cutting-edge science, innovative tech platforms, and advanced research and development capabilities to lower treatment costs while improving healthcare outcomes. As a leading oncology player, we started our journey in India with the introduction of a novel antibody for head and neck cancer in 2006. Today, nimotuzumab is being used as a targeted biological therapy in head and neck cancer. Over 25,000 patients so far have benefited from nimotuzumab in India. Biocon Biologics has many firsts to its credit, including the approval of world's first biosimilar trastuzumab for breast cancer, which was launched in India in 2014. More than 25,000 breast cancer patients in India have benefited from Biocon's trastuzumab. Biocon Biologics was the first company in the world to have received approval for its biosimilar trastuzumab from the US FDA. Today, this is the most authentic biosimilar available for patients in India. Globally, our trastuzumab is approved in over 70 countries, and thousands of patients are benefiting from our biosimilar trastuzumab across the world. Our biosimilars oncology portfolio also includes bevacizumab and pegfilgrastim. We are thankful to our network of over 1,600 oncologists and 225 hospitals in India who have helped us impact nearly 50,000 cancer patient lives over the years. As a part of our commitment to improve patient outcomes, we are constantly engaged in many patient outreach programs and conduct public awareness webinars along with our partners. We recently conducted a public poll on social media and found out that there are many myths associated with breast cancer and realized that we need to step up such awareness drives. For example, 35% of the participants thought that breast cancer is a hereditary disease, while the fact is only about 5 to 10% of breast cancers are believed to be hereditary. The majority of the people who get breast cancer have no family history, which suggests that there are other factors at work. Similarly, it is generally believed that men cannot get breast cancer and that it affects only women. However, that's not true either. Breast cancer is rarer in men, but it does happen. People often think that men can't get breast cancer because they don't have breasts, but they do have breast tissue. In fact, it is seen that male breast cancer is diagnosed at a very late stage simply because breast tissue changes and lumps in men often get missed out. Similarly, we realize that many people think that only women above 50 are prone to breast cancer, and younger women cannot develop breast cancer. However, breast cancer can strike at any age, as all of us know. Even though only 5% of all breast cancers occur in women under 40, all young women do run the risk of breast cancer. Therefore, they must do regular self-examination and periodic screening to de-risk themselves. Another interesting aspect that we found out through this poll was that generally people associate breast cancer with a lump, whereas there are several other symptoms that we need to be watchful of. Not everyone will have a lump. Hence, we need to be more aware of what are the various symptoms of breast cancer. Only when we become more aware and take all precautionary measures, we will be able to prevent the progression of this disease. With the kind of targeted therapies available today, we have seen that breast cancer has become manageable. It is no longer a threat to life. If detected early and if treated early, it leads to much better patient outcomes in terms of their survival period and the quality of life. There are cases where people have recovered fully and have lived a healthy cancer-free life for 15 to 20 years after early diagnosis and effective treatment. I would now like to conclude by saying that early diagnosis of breast cancer is key to saving lives. And the esteemed panel of experts present today, along with Aparna from Patients Engage Forum, will provide you greater insights into this subject. And with that, I would like to thank all of you for being here today and hand it back to Aparna. Thank you, Aparna.
Thank you, Seema. Let's start with the discussion. Dr. Poonam, I think we have now Dr. Rajpurohit and Dr. Anita as well. Dr. Poonam, let me start with you. Can you shed light on the prevalence of breast cancer in women and especially young women? And when we say young, what is considered young? You know,
So first of all, thanks for having me here today. And it's Breast Cancer Awareness Month. October is running as Breast Cancer Awareness Month. So it's very important that including us all, everybody else, be aware of our own body. And breast cancer incidence is increasing. It is something very concerning that the incidence is increasing. Incidence increases with as age increases, but even otherwise, the incidence is increasing over the last few years. So earlier, breast cancer was thought that earlier it was about 14% of all cancers in women. Now it is nearly 25% of all cancers in women. So the incidence is increasing. The age is also reducing. Earlier, it was thought that it's a disease of postmenopausal women, that is women above 50, 60 years of age. But now we see even younger women having breast cancer. And young means what we consider young is generally less than 50 years of age.
Right.
So earlier it was that cancer, especially of the breast, comes to women after 50 years of age. Now many women are seen after age 30 years of age also having breast cancer. In fact, we have also got one patient who is 18 years old girl who just got into college but diagnosed as breast cancer. So wow. Age is not really the only criteria. We are getting younger and younger patients now. And actually, if the lady is around 50 years of age, so 1 in 50 are prone to get breast cancer. And at age of 25 years, it is 1 in 2,500 who get breast cancer. But the incidence, as I told you now, is increasing. Between 30 to 40 years of age, we have now approximately 1,500 women per year getting diagnosed with breast cancer in India itself. So right. Younger age, the incidence is less, but when we go to 40 to 50 years of age, the incidence goes high. Between 40 to 45, actually, it is approximately 2,500 women diagnosed per year. But between 45 to 50 itself, it's a huge number. It's around 5,000.
Right, right. Okay. Thank you, Dr. Poonam, for shedding light on that. Dr. Rajpurohit, can you talk about the risk factors for breast cancer? Because there's a lot of, as Seema said, most people think it's hereditary, but there are other risk factors as well, right?
So, Aparna, the most common risk factors is actually continuous estrogen exposure over the lifetime. So, each component can have some degree of increased risk, like early menarche, late menopause, being not married or being nulliparous, then having sometimes.
Sorry, can I just elaborate that when you say not married, you mean you've not had a child because
no childbearing, no
right.
childbearing, So there's no break with the progesterone cycle, and there's a continuous estrogen exposure. So other thing is that sometimes women were. Nowadays, we have stopped this practice, but then there was a time when women were on hormone replacement therapy. So that kind of risk could have actually increased the chance of. So that has been the key risk factor.
Right.
Apart from that, the other risk factor, which is hereditary or familial, is in the tune of 10 to 15% of all the cases.
Right.
So yeah, so the common risk factors are these types, and sometimes it can be without any risk factors, and that can be sporadic breast cancer also. And increasing age itself is a important risk factor for breast cancer. So most of the cancers actually happen beyond the age of 60 years in most women.
Right. Okay. Thank you. Urvi, you want to go ahead? Are you there or are you frozen? Ah, okay.
Yeah. Yes. So, yeah, I'm there.
Yeah, go ahead.
So, I would like Dr. Anita to talk about the symptoms of breast cancer.
Yeah. Yeah, you can hear me and see me?
Yes, Dr.
Yes.
Anita.
Yeah. Thank you very much for having me in the forum. Yeah, just to tell you about the symptoms and signs. Okay, remember when the symptoms and sign comes, it's a little advanced stage in breast cancer. That is one thing which needs to be emphasized and told to all the viewers. Don't wait for the symptoms. It needs to be picked up early. That is why we go for screening, we go for self-breast examination, we do the mammos, early stage ultrasound mammo, and you need to visit the doctor. So we need to screen and pick up. Yes, if you have missed it, otherwise, usually women will present with small lump in the breast. Okay, there may be lump at any area of the breast, even below the breast, in the center of the two breasts, in the neck area, or in the axilla even. You may have retraction of the nipple. You may also have bleeding from the nipple. Milk with the blood secretion from the nipple takes place, and there is retraction of the breast. The skin becomes puckered. Sometimes the skin looks like an orange. There is pain. Okay, and the breast also increases in size. So these are some of the symptoms which are which the patient can themselves pick up. Apart from this, if you have crossed stage 1, 2, 3, and you're in the stage 4, we do get patients presenting with back pain, spinal mets. We do have patients presenting with breathing difficulty, fluid in the lung, pulmonary mets. We do patient presenting with jaundice, liver mets. We do patient presenting sudden unconsciousness, suddenly gets fits, yes, CNS disease, and etc. Anywhere in the body, the tumor can spread. But yes, first of all, you should pick up breast cancer before they produce signs and symptoms. And that's what the need of the day: awareness, prevention, early detection. Thank you.
Right. Thank you, Dr. Anita.
Dr. Rohini, can you? Thank you. Yeah, Dr. Rohini, can you tell us which were the symptoms you noticed? Like, what was your experience?
First of all, thank you very much for having me over here. And symptom, it is 19 years back. On one Saturday afternoon, I was doing my breast self-examination. And I just thought that why my one rib on right side is abnormal. That has gone something crooked. That's what I thought, that why it is abnormal. And I kept on examining repeatedly. And then I found, no, this is not the rib which is abnormal. This is something, a small nodule there, which is hard fixed. And that is what, I could feel. And being a medico myself, the diagnosis was crystal clear to me: hard fixed nodule. And that is what, and no other symptom at all. It was only because of my breast self-examination I could find out that small nodule 19 years back.
Right. Okay. I think Dr. Rajpurohit or Dr. Poonam, I think there's a question which is asking for clarification as to why, if women who don't have children, why are they at a greater risk of breast cancer? And also, is the risk higher for women who are sexually inactive?
Okay. So as Dr. Rajpurohit said, that it is basically a cycle of estrogen, which is there in the body, which acts as a cancer stimulating agent for the breast. So when there is a pregnancy, that time the ovaries stop functioning and stop producing estrogen basically. So because estrogen is not produced, that leads to a protective effect on the breast.
Right.
Second is that when after pregnancy, the breast is more mature to form milk. So if the ducts are fully mature, the glands are fully mature, again, there is a lesser chance of having cancer in them. So both pregnancy and lactation confer protection for breast cancer.
Right. And is there any risk associated with sexual activity or inactivity?
No, no.
Okay.
Not for breast cancer.
Not for breast cancer. Dr. Rajpurohit, you also talked of hormone replacement therapy, but what about oral contraceptives? That's another question that we have just gotten. Does that increase the risk? Is Dr. Rajpurohit there? Otherwise, if Dr. Poonam or Dr. Anita can take the question. Dr. Poonam, go ahead, please.
Yeah. So it was about oral contraceptives. Now the oral contraceptives that are there, they contain very less amount of estrogen or none at all. It
Right.
was the older type generation of contraceptives which were said to cause this cancer creating effect on the breast cancer, not the new generation of oral contraceptives. Dr.
Right.
Rohini, what has been your practice? You are an OBGYN doctor, so patients must be coming
Absolutely.
to you.
Yes, yes, ma'am. The earlier one, they had a higher dose, and now we have a low dose contraceptive pills, which don't have the risk which were there in the earlier oral contraceptive. And yes, that also, people used to take it continuously, and you will be surprised that how can one take it over a period for 10 years or so. But yes, the woman, she gets the prescription of contraceptive pill, she will preserve it, and without visiting a gynecologist, she will be taking it. One of my patients who came at age 53 years, her complaints were just that I have completed my 53 years and I am not having menopause. And asking the history, I knew she was still taking oral contraceptive pills, which was prescribed to her decades back. So that is how it happens. But then now, if one is using the low dose contraceptive pills, the risk is negligible.
Right. Thank you, Dr. Rohini. Dr. Anita, are you there?
Yes, I'm there, please.
Yeah. What are the specific challenges faced during diagnosis of breast cancer in younger women? Because we do find patients coming to us and saying that, look, we thought we had it, then we were not sure, and so on and so forth.
Yes, yes. In the young age, what happens, the breast is little dense and it is difficult to make out any swelling and a lump. And sometimes, yes, younger girls do have something called fibroadenosis, fibroadenoma. These are two benign conditions of the breast, which does prevail in many women starting from their little bit beyond teens and young age. And they always get frightened that this may be cancer. Some may not notice it. So they run to the doctor. So sometimes we may miss it or thinking it to be fibroadenoma, but it is always better to overdiagnose, have an ultrasound mammogram done, if not the radiology ultrasound done, and meet a doctor, particularly a surgeon, and get it cleared. That's one area I have seen some young ladies miss the breast cancer. Another area which I have observed is during breastfeeding. Okay, they think that it is a cyst or milk spilling of the breast, and that's when they don't meet the doctor. And then you have the breast cancers which are coming during pregnancies. They're highly aggressive. They spread very fast. They have lymphangitis, and you miss the diagnosis and with the child, and then that's a horrible very situation. So that's another area where we miss. Secondly, whatever said and done, I have patients coming from affluent society who doesn't know that we have breast cancer. They will keep handkerchief there to hide the secretions and the blood coming out, but they don't want to tell. Social stigma. Yes. Next, if you go to the rural areas, uneducated people, they are not aware. Finance is an issue. Distance from place, workload, family, multitasking. Corona pandemic has all put us one step back in breast cancer treatment and diagnosis. We have missed many early. On the other hand, we have been able to pick up many when we do the CT scan of a COVID patient, suspected COVID. I had many cases picked up breast lump, even lung nodule. We have picked up lung cancer at early stage also. So COVID it's a double-edged sword, so brought us many things. So I think these are some of the challenges at all level of society, at all level of financial strata, as well as educational level. We have missed the diagnosis of breast cancer in many, and particularly young women who have many other things at that point of time in life.
Right. Thank you, Dr. Anita. Dr. Rohini, as a OBGYN, do you have anything else that you would like to add to what Anita said? Because again, gynaes are what women of that age are typically, seeing more often, and they're more comfortable with. So, do you have any observation from your practice?
Yes, like Dr. Anita said about the rural population, I work more with rural population for the awareness and screening. I do go to the interior, but then, in rural population and as well as in urban population, when one has a nodule or a lump, rather than going to the surgeon or a doctor, the lady first consults the relatives and the friends. And then typically the diagnosis in rural population, from where I am here in Maharashtra, the diagnosis always they put forward is it's a milk lump. Okay. And there where the things go wrong and the disease progresses, and rural population, although the incidence is less, we get it in advanced stage. As rightly said about the financial constraints and reaching to the place where they can be doing. And I have seen myself that when I go for the screening, they go for work in the farm, and I have to adjust their timing in that way that they don't miss their daily wages. Right. So that's what it is. But then all said and done, the women, they come first to the gynecologist. They have some rapport, they come to them, whatever complaints they have. And here comes the role of opportunistic screening and making them aware that they should be knowing what is normal for them through breast self-examination. And then only they will know if something abnormal goes. And if they find something abnormal, we have to assure them and we have to tell them that they should not panic and they should just take an opinion of a doctor who would tell whether it is to be, worried about or not the friends or the relatives. Right. And that's what the role of opportunistic screening for whatever complaint the lady comes to you, we should be doing.
Yeah. So I think one of the things that I do wonder is whether, as you said, opportunistic screening, should they at least do a clinical breast exam? I think one of the things we don't have a practice of is the doctor doing the clinical breast exam, so would that be a way forward for gynaes to take on? I know it's more work for the gynaes and, you're already stretched, but if at least on a periodic basis, or at least teach people to do breast self-exam properly as well, right? Because I think that's also a challenge. And we'll come to that a little bit more, but just wanted to get your views on that, Dr. Rohini. Okay, sorry. So coming to, go ahead, Urvi.
Yeah, so I would like to ask Dr. Poonam Patil about the breast examination. And is there any age when a young woman should start self-examination?
Okay, thank you, Dr. Urvi. Very, very important thing, because that way a woman can have some power in their own hands, like how Dr. Rohini said, that it was actually self-examination that brought the lump to her notice. So the intention is to detect breast cancer as early as possible, because breast cancer, when detected early, has got high cure rates. So this is a very important way of screening for breast cancer. And we all know that finding breast cancer before the symptoms appear helps in diagnosing the cancer at an early stage. So actually speaking, once the woman is 20 years of age, they should start doing breast self-examination. Why that 20 years of age? Not that cancer is going to occur at 20 years of age for all, but that's the time when there are so many changes taking place in the breast. So if the woman is aware of all the changes that are occurring in the breast, she will be able to find out, okay, this is something that happens in the breast normally before periods or after periods. This is how the breasts feel. They are a little tender, a little swollen before periods, but after periods, the breast swelling comes down. This is how they feel now. This is how they are feeling later. So they kind of come into the flow of examination. And unless and until they know what is normal for them, they cannot make out what is abnormal for them. So start at the age of 20 years generally is what I would say, and monthly examine the breast and underarms region in the first week after periods. That's the best time to do so.
Thank you. Thank you.
Yeah, so Dr. Rajpurohit, what are the, because there's also these days people are very concerned about what are the lifestyle changes they can make to reduce the risk of cancer. So specifically as related to breast cancer, what are the lifestyle changes that can help?
So I think the most important thing is body mass index. That is one thing which is very important, especially with respect to the both the breast as well as the gynecologic cancers like endometrium and to some extent ovarian cancer also. And sometimes women are suffering from PCOD, or nowadays also there's a trend towards going for IVF treatments also, late childbirth. All these things are important. So ideally, in an ideal world, if a woman is doing the things on a, like I would say, getting married early, having children at the right time, and keeping herself fit, then probably she's having almost, I would say, half the risk of what the other population which would have. So these are important aspects. And otherwise also the kind of food we are taking nowadays is all processed food. So in totality, I think the lifestyle which normally a rural population would otherwise would have had, a woman who was in fields working every day, having early marriage and all those things, they had probably less chance of having breast cancer. But having said that, I think once we have this awareness in the urban population that these are the important risk factors, that can go a long way in preventing these risk factors to cause breast cancer.
Right. So as far as that is concerned, we had one question, Dr. Rajpurohit, as well, is because I think you talked of the estrogen buildup, and if you, for women who don't want to get pregnant, is there any other way to break that, continuous estrogen buildup other than oral contraception?
I think apart from OCPs, there are not many suitable ways by which we can have an evidence-based kind of a thing. But then yes, like metabolism is very important. So when you're obese, your level of estrogens go high. When you have got a sedentary lifestyle, then your hormonal imbalance occurs. And especially with the women who have conditions of the ovary, that can also have an impact upon the estrogen level. So if those conditions are prevented or they are treated well, then this can lead to a, I would say, a optimal estrogen exposure for the women.
Okay. Dr. Rohini, would you want to add to that?
Yes, about the estrogen.
The contraception options for women in order to, those who don't want to get pregnant.
Yes, when we are prescribing, as I told you, that once you give the prescription and that is, preserved, they keep with them. So when you give the prescription, you always have should be telling the patient that you are going to take it, and one has to give a break in between.
Right.
The continuous estrogen, high doses of estrogen exposure is what plays havoc. So you have to tell them that they have to take a break. And nowadays, where we have a low dose contraceptive pills, yes, they do have a breakthrough bleeding, but then you have to tell them what is the advantage. And in that case, they are ready to accept that also, where they have intermenstrual spotting or breakthrough bleeding in between. So that is acceptable. So, but once you tell them the importance and explain them, that would be taken care. That's what I feel.
Okay, thanks. Before we get to the next question that Urvi will ask, there's also a question because there was a discussion on childbirth. What is the right time for childbirth from a, I guess, breast cancer prevention standpoint? Anybody would like to take it?
That is, I think Dr. Poonam would always would agree to it, that we always advise whenever they come, the first child should be before age 30 years. And as soon as the breast tissue, the cells that get mature, they are less liable to have those changes. But then if suppose the childbearing is late, the changes which have happened, they replicate once they, the breast development is there and starting. So the first child is preferably before the 30 years of age.
Right. Okay. Thanks. Yeah, Urvi, go ahead. Sorry, Urvi, are you going ahead with the next question?
Yeah. Okay. Yeah. So what are some of the social challenges associated with younger women getting breast cancer? Anyone can take this question.
Yeah, some of the social challenges which the younger woman gets is, one of them is that you miss the diagnosis. You are present at a later stage. You're busy with your early part in your career in life. So usually they are all advanced cancers, younger patients, remember, and they are a little bit of aggressive tumors. And as we know, the triple negatives, that is the BRCA of the tumor is high, and triple negative is a type of breast cancer which does very badly. Okay, and they start spreading, and the spread survival less for these patients. And just to tell to everybody that the young women who get the breast cancer, they don't do very well. Okay, they have advanced cancer, the cancer comes back, it is difficult to control, survival is much poorer for them. Okay, apart from this also, I told you during pregnancy, early women in their first pregnancy, second pregnancy, if they get those pregnancy-induced cancer, again, that is also, again, very aggressive, and chance of survival is also very less. So these are two very cancers which really take your life. And we have less of young women who are survivors, but we have more of elderly women who have survived the cancer. Apart from this, yes, with family, access to healthcare, financial issues, treatment of the going to the treatment, taking the radiation, chemosurgery becomes a challenge, and accessibility from your house to the place, taking off leave, and moreover, social stigma. We have seen many families breaking up during when all these diseases are diagnosed. And until and unless the government helps you, or you have your own private insurance, or you have your finances ready, young women find it really difficult to cope up with the treatment, with the family, and with the complex society. And I think it's a little bad, sad scenario when somebody at that young age with children around, husband is there, family, and you get a breast cancer. And it needs a lot of effort to come out of it.
Thank you. Thank you, Dr. Anita. Dr. Poonam, would you like to add based on your experience?
The patient, of course, has to be strong, but even the society has to be sensitized. I think that's very important, because it could be anyone.
Correct.
It could be anyone, which we don't realize. We always think that the worst is going to happen with somebody else and never with one of us.
Right.
So the society also has to be sensitized, that one should have an empathy displayed towards people rather than sympathy and pity.
Right.
Absolutely.
Absolutely. Thanks. Next question. Yeah, go ahead.
Next question. Yeah. There are a lot of myths and misconceptions about this breast cancer. Are there any that you would like to address, like Dr. Rohini or anyone?
Yes, the myths and misconception that which I face a lot when I go for the screening. The thing starts from screening itself. People are not ready to get screened. When we go to rural population, first we have to counsel them and then get it. First and foremost is हमारे घर में तो किसी को हुआ ही नहीं है, तो मुझे तो ये करने की जरूरत ही नहीं है. So they, straight away refuse getting screened. So you have to counsel them and then tell them that, yes, there is a role of family history, but then it is just somewhere between 10 to 13% that when we go and we see that one who had breast cancer, out of them only 10 to 13%, they have a family history of breast cancer or ovarian cancer in that case. That has to be dealt with each and every time. मुझे तो घर में, हमारे घर में किसी को नहीं है. That is a myth कि हमारे घर में किसी को नहीं है तो मुझे होगा ही नहीं. But then it is not like that. Without, right. I never had any risk factors, but then I had it.
Correct, correct. Dr. Poonam, would you like to add?
Yeah, like Dr. Seema had already mentioned earlier that breast cancer most of the times presents as a lump, but sometimes there are symptoms other than lump also, especially in young women who are lactating or who are pregnant or lactating, and the breast is already always a little enlarged in size. And if there is a malignancy during that time, which is also known as inflammatory breast cancer, they may actually not find a lump as such, but there would be skin changes, right, which are mistaken for something else. And as Dr. Rohini had said, that sometimes these lumps are thought to be milk cysts, and women just ignore it, saying that, oh, I did not feed baby yesterday from this side of the breast, and maybe this may be a milk cyst, and things like that. So there are common misconceptions that always a lump has to be there, but there could be skin changes as well. There could be just a bloodstained discharge, which may be a symptom of breast cancer. So these things also need to be kept in mind.
Right. And also, I think one of the things we found is that people are always surprised that there was no pain. You know, the standard thing they come back and says, but, you know, there was no pain in that lump, kind of thing. So, how because common is pain?
Very common symptom that it is not it is always a painless lump to begin with 95% of the times.
Right.
And because there is no pain and the lump is not bothering them, it is not changing their life and lifestyle, women kind of ignore it.
Right. And is there a way for an individual to differentiate that this lump is cancerous versus it's not? You know, during...
I would rather not let them judge. I would rather that they seek medical attention.
Correct. Thank you. One question we've received is, does breast cancer treatment affect fertility? And if so, what can be done about it now?
So Dr. Rohini,
yes, it does affect the fertility, the chemotherapy, the ovaries, they become inactive, and there are options available like
fertility preservation, right? So
like, you have the embryos or the ovum which are retrieved and preserved, and later on those can be used, assisted reproductive techniques which are there, but then that call has to be taken before starting the treatment. Because many a times we see that when the patient is undergoing chemotherapy, they stop their menstrual cycle, and this menstrual cycle in younger generation, we find it they get back the menstrual cycle, and many a times the elderly, one who are in 40s, the return back of menstruation is not seen. But then this is because the ovarian suppression is there, and that is the reason. And the question is so many times asked that if suppose you go in for having a pregnancy, will the baby be abnormal? But then you have to wait for a period and then go in for it, so that you don't have a residual effect on the ovum, which is going to be fertilized. Right. That is what is about the fertility.
Right. Okay. Anything else, Dr. Poonam or Dr. Rajpurohit, that you would want to add on that?
Yeah, I had recently a patient who was from a very well-educated family, and she did feel a lump, but she ignored it, saying that she was a very healthy person. She was always running marathons and she was not overweight, she was not obese, and she always had organic food and always relied on fresh fruits and vegetables, never had junk food. So she thought that this painless lump cannot be cancer. So as you were telling that if patients can themselves detect whether it is a malignant lump or not,
right,
that's how they tend to miss it. So if there is any lump, let the doctor decide. That is what my take on it.
Meeting they are sorting out till 5 o'clock. I was struggling for the criminal.
Sorry, Dr. Anita, you.
Yes, sorry. Yes.
You wanting to add something?
Yeah, one thing which I wanted to add for every woman with cancer, many of them think that it is very expensive treatment and we don't have access to the treatment and we will die and the family, we have to sell this, sell that. So that myth has to go, and it's a very, very important thing. And we have to encourage them. Yes, one is important. Yes, you need to have, apart from the treatment, everything, what I would like to say, yes, if you have your private insurance, the entire treatment of breast cancer is covered. If you have corporate insurance from your company or is the government insurance, it is also completely covered, entire treatment. Those who do not have any treatment, particularly the rural people, the general population, and I think 80% of the population belongs to that, and that's the chunk where we need to target. And we have the government scheme, I think in several states it has started, Tamil Nadu, Andhra, and I think many of the states are adopting this. And it is also it's with the Pradhan Mantri Ayushman Bharat scheme, which has 5 lakhs in it. And the last 10 to 15 years, I have been treating breast cancer. I tell everybody, don't be afraid. If you have cancer, it is treatable, and treatment is given free in most of the hospital. I'm in the medical college, and I feel quite privileged that I'm able to help them. It's just not picking up. And then what do? You leave them if you can't treat. It's not, you have to treat them when they are diagnosed. So with this scheme, you can do the scans, you can do the biopsy, they give you money for the chemotherapy, all the 8 cycles, they give money for the radiation, they give money for the surgery. And if the tumor comes back, yes, even the newer molecules, that is the trastuzumab, is approved by the scheme. And also if you fail, suppose it will definitely come back for a section of the society, particularly younger people, and they give money for the palliative chemo. They may not support you with the higher molecules like immunotherapy and the big targeted drugs, but definitely basic cancer care is covered in India. So one should be very happy, and being an Indian, we should be proud, and having company like Biocon with us, which supports us with the patient assistance program. And this is something very important. You pick up the call and ask them, you get a free vial done. Actually, when you interrupted me, I was talking to Biocon for one of their drugs for a woman for cancer. I need free medicine. So thanks to the company, they give huge support, and that's how we are able to do. So all women in India, don't be afraid, because you cannot stop the cancer from coming. The cancer will come. You can pick it up early, treat early, your survival is higher. But suppose you miss it, yes, treatment is available, and it is unlike other countries like US and you don't have this much. Rather in India, it's very accessible. Go to any of the tertiary colleges, even medical colleges all over the country, they offer, and the cancer centers are there. If you don't have the card is made in 2 days to 3 days time, the Ayushman Bharat card, and use the card for diagnosis. You can complete your entire treatment without much spending, or minimum spending, I will say. Officially, you should not charge a patient with that card. 80% of the Indian population is eligible for the card. And the richer section, they all have their private insurance, corporate people have, and those who are government servants, they have their central government scheme, state government scheme. You get it completely, treatment is covered. And so I think future is good, and we need companies like you to help us to go forward for really the needy people. Just I need to write, yes, Biocon, help me with the free sample. That's what is needed.
Thank you. Thank you, Dr. Anita. One question which we've got, a couple of questions that are coming in, just want to quickly take them. If it's a fibroadenoma, should it be removed or can it become cancerous? Should we ask Dr. Rohini on this? Yeah.
There are very less chances that fibroadenoma goes in for a change into malignancy, but then it's 1% or less than 1%. But then any lump which is there should be investigated.
Right.
Until proved,
right.
what should be investigated.
So I'll just add on to it.
Sure.
If the age also is significant, like if there's a lady above 50 years of age who comes with a lump which has been written as fibroadenoma or which has been suspected to be fibroadenoma, that is the age where actually the fibroadenomas or benign breast tumors are not so common as malignant lumps are. So there I will definitely do a biopsy and investigate that are we missing a malignancy or is it really a fibroadenoma. But if the same thing is seen in a 20-year-old girl, it is more likely to be fibroadenoma rather than breast cancer.
However, you would not want them to make that judgment themselves.
Yes, yes, yes.
So, yeah. I think I also want, doctor, if you can explain the concept of risk, because, I think when we say certain things increases risk, how much does it, so if, for instance, 1 in 8 women have a risk of breast cancer, then if you say that alcohol consumption increases risk, so does that become from 1, does it become, kind of 2 in 8, or it's a 5% increase, so it's 1.05. I think just to put in context, because otherwise people get scared with, all of these messages around risk, while we need to be aware, but we don't want to create panic as well.
Yes. So it is just a risk factor means what makes you a little more likely to have cancer compared to the other women who don't have any of the risk factors. So there are modifiable risk factors and there are non-modifiable risk factors. So non-modifiable risk factors are being a female, increasing age, a family history, genetics, or some kind of genes that we have inherited in our family which make us a little more prone, age of menarche, age of menopause. They're all non-modifiable risk factors.
Right.
So as Dr. Rajpurohit said, that women who have had an early menarche, that is when the period started much early. Say there is a girl who started her periods at 9 years of age.
Right.
And her menopause occurred at say 50, 55 years of age.
Right.
Compared to that, there's another girl who started her periods at 18 years of age and had a menopause at 40 years of age. So the woman who has got a shorter menstrual history or a menstrual menstruating time, that lady is at a lesser risk of having cancer compared to the woman who has got a longer menstruation duration.
Right, right.
So that these are risk factors. So there are these non-modifiable risk factors. Modifiable risk factors are what Dr. Rajpurohit said about lifestyle, like obesity.
Right, right.
So these are the modifiable risk factors.
There's one question.
Does not mean
Sorry,
that
go ahead.
supposing this gene is there, that means I'm 100% going to get breast cancer. Or if my mother had breast cancer, I'm 100% going to go get breast cancer. I have a family history, I'm 100% going to get breast cancer. That's not like that. Supposing for one risk factor, if the incidence of breast cancer with women of that type is say 1 in 100 normally at that age, if there is one risk factor, it may become 2 in 100. That doesn't mean that everybody is going to get cancer if that risk factor is present.
Correct, correct. Okay. There's also a question, do the kind of innerwear, which, because I think there is this thing that goes around about wired bras, etc. So, do the kind of innerwear which women use affect the health of breasts?
Not really.
I don't think so. The innerwear has any effect on the breast cancer being developed because that is an external thing, and the breast cancer does not occur on the skin. It occurs on the breast parenchyma. Particularly, it is on the milk ducts only. It's not even, the cancer is not even in the fat. So this may not be a thing. I think there was another one more question that came up, alcohol and risk of breast cancer.
So I think she asked about moderate alcohol consumption. So if you can define what is moderate or what is acceptable.
Yeah. So, see, as such, by definition, alcohol is not, like tobacco is a carcinogenic agent, but alcohol is still not defined as carcinogenic agent, except direct relationship of alcohol and hepatic cancer. But otherwise, along with drinking and smoking, the risk increases of any cancer, head, neck, and that also you have a breast cancer increased risk, and that's what we call Western lifestyle of a woman makes it proceed towards more of the breast cancer. So yes, difficult to say directly that yes, with alcohol you will get cancer. It's not like that. But alcohol, smoking, sedentary body habits, and all the other parameters which my panelists have mentioned all add to your risk. By definition, moderate consumption. Now, every drink has a different percentage of the alcohol in it. You may take beer, you may take 1 peg of wine, but the amount of alcohol content differs. So every drink has its own measurable unit. So we have to go by what drink. It is vodka, it is beer, it is wine, it has a. So yes, by definition, yes, per week, you should not exceed your limit. For women, the limit of drinking is also lesser than that of men. Okay, but then if you at all want to drink, be an occasional drink. And that's what I can suggest, but I can't tell you don't stop drinking. With tobacco, yes, I can say ban tobacco, no tobacco, but I can't say you don't drink. But yes, should as a medical person, don't drink.
Right.
Don't
right.
drink.
Thank you.
Thank you. Thank Aparna. I need to sign out in the
Sure.
hospital. I have patients and time is also there. Thanks a
Sure,
lot.
sure. Thank you. Thank you, Dr. Anita. Thank you so much. Yeah, I think we pretty much are done with the questions. I'll just check if there's any more. There was one specific question, but I will take that offline because I think it was post-treatment issue, unless the panel wants to take it. I think if you want to each give your final takeaways, I think that would be great. Dr. Poonam, if you want to start with your final.
Yeah, so I would urge all women to come out stronger by identifying steps to protect themselves. This pandemic has really taught us that health is indeed wealth. So be strong, be healthy, be in charge of your health. And knowing about cancer and what you can do to help reduce your risk can save your life. So that is probably the best defense. And the next key is early detection. Finding cancer early before it has spread also gives a chance of cure in breast cancer. So do breast self-examination, and depending on your age, go for regular checkups as well. And if there is anything detected, do not worry. As Dr. Anita said, as Dr. Rohini said, that it is something which has got a high chance of cure if detected early. Thank you all very much.
Thank you, Dr. Poonam. Dr. Rohini?
I would always say that what is normal, then only you will be able to detect what is abnormal in your body. And stay active, do breast self-examination, and prioritize your health. That is what I would tell you.
Right. Thank you, Dr. Rohini. Seema, do you have any final words before Urvi and I wrap up?
I would only like to thank all the panelists for sparing their time and being here and taking all the questions. Very interesting conversations and very interesting questions. And I hope we'll continue to have more such sessions. So that's all. Thank you.
Thank you. Thank you, Seema. Urvi, any message from you?
No, like it's treatable and be strong. That's it.
Yeah, I think the fact that we have two breast cancer survivors on this panel, and both of them had what's considered breast cancer in younger women, is a testimony that breast cancer is treatable. They are also examples of people who lived healthy lives. So it's not your fault if you have it, but you can try and minimize the risk. And as everybody has said, know your breast. So start breast self-exam now and do it monthly. There are specific guidelines on how to do it. So you can check our videos on that as well. And really know your breasts well. And do not get scared. Do reach out if you are suspicious. Doesn't matter if the doctor thinks you're overly suspicious, but do reach out and get a clinical diagnosis if you have any signs or anything that worries you. And don't forward any myths and misconceptions unless you're sure and get it verified. So please don't believe the WhatsApp fake news stuff. So I think that's also something to be aware about. So thank you, everyone. Thank you for all of you, all the panelists who've taken so much time to attend and to join and to answer so many questions, and to our audience. Thank you for prioritizing your health and taking interest in a topic of great concern and also topical in the Breast Cancer Awareness Month. And thank you, Biocon, for your support. Thank you.
Thank you so much.
Thank you, everyone.
Thank you.